So I'm just laying here, falling asleep. The light was off. It's very bright. But as I was about to fall asleep and I'm so comfy laying here, I realized that in not very many days, I will be back to sleeping only on my back and not being very comfy for a long time. So I'm just trying to enjoy it and soak it up, you know? Okay. Good night.
I already got my pictures taken last at my 6-month checkup when we confirmed doing this surgery. So normally that's something that I believe would happen as part of the pre-op, but I've already done that. So today I believe I'm gonna have like that first part of the appointment where they're gonna basically ask if I have any questions, and I don't really remember this part of the appointment from last time, but I do remember that it was this day that I had to go pick up my prescriptions and stuff too. So that's what I'm expecting. Like, I'm expecting to do that again, which fortunately is all at the same place. So I'll keep you updated, but right now I'm just driving there, and hopefully eventually we'll get there and not melt on the way. Yeah. Okay, so I'm back and it's a few hours later. I'm at home sitting on my living room floor in front of my big old desk. So let's talk about what happened at the appointment. They took my vitals. They made sure that we're all on the same page as far as like the plan, the appointment time, the location, the like all that kind of all that kind of stuff. And then I was given a bunch of different pieces of paperwork. So there's home care for breast reduction instructions, and then this is talking about medications. Like, it's just more instructions, but about like medications and the day of surgery. Should I read this? Do you want to know? Okay, I'll just put a timestamp. I'm going to read a little bit from each of these things because I'm guessing that you're maybe kind of curious. And if you're not, then skip ahead to this time. Okay, so as far as instructions are concerned, it says to continue all medications unless listed right here, but there's nothing listed. So I'm just supposed to take anything I'm already taking as per usual. Stop taking any aspirin containing products 7 days prior to surgery. Stop taking ibuprofen at least 24 hours prior to surgery, etc., etc. The day of surgery, like I said, bring ID, shower with dial soap, which is underlined and in bold, but don't shave. The morning of surgery, brush your teeth and take any morning medications with sips of water. Wear comfortable loose clothing and comfortable shoes. You may have bulky dressings following surgery. Do not wear contact lenses. Remove all jewelry, including all body piercings. Leave valuables at home. Do not wear makeup, lip balm, lotions, powders, deodorants, cologne, or perfume. Remove nail polish from at least one finger. Okay, so I did clarify about the whole nail polish situation while I was there. And basically what they said was you could have your nails like manicured or have polish on them, but at least one of them either has to be like blank and clean or have clear polish. Hi, Blue. Okay, for the billionth time, restarting the camera. You know, sometimes you have a period and it's like, doesn't really faze you. You just go through all the motions and then it's done. And then other times you have a period and it completely fucks with everything. That's the kind I'm having. It's terrible and I hate it. Okay, next thing. So this paper goes with these really loud things. Same thing I got last time, so I struggled so hard last time trying to pronounce this. 2% chlorhexidine gluconate cloth. And basically it's just a really heavy antiseptic, but to like cleanse your skin so that, and you're supposed to go over your whole body, but you're supposed to focus on the area that they're gonna perform the surgery on. Some places that you go for this surgery and other surgeries will give you these specific or similar wipes, but other places will just tell you to wash really well with soap, and then they'll cleanse you like when you get there, maybe even when you're under anesthesia, and you might not remember it at all. I think for me, they do all of it, so it's just like multi-cleanse situation over and over again. Make sure there's no infections. For my specific instructions, I have to wipe my whole body down with those. There's multiple packs of the wipes in each pack, so there's literally 6 of these packs of wipes, and I'm supposed to use all of them. One whole thing of them the night before, and then one whole thing of them the morning of. Okay, so this is their checklist to make sure that they gave me everything. Post-op bra. So this is the new one of those. Super lovely. Oh, I already have a post-op appointment. I didn't realize. Okay, so 16 July. Can you just leave me alone for a minute? I love you so much. You're being a little obnoxious. Post-operative medications. So all my stuff is right here. I was given the same exact things as I was given last time. So I have, how many? 20 5-milligram tabs of oxycodone and Docusate or Colace, which is the nausea medication. This is also nausea medication, but it's literally just like 1 tab of it, and I'm supposed to take this the morning of before surgery. Yeah, the morning of surgery. Okay, really, you two are just, I love them so much, but right now I'm just not in the mood. Today is not the day, and I'm not the one, but nevertheless I am the one, and apparently today is the day. And then also acetaminophen to pair with the oxycodone, and yeah. And then just at the bottom of the sheet is a little bit more instruction stuff saying review all the things that they've given me, make sure I'm familiar with all the instructions. Nothing to eat after midnight, but you may have clear liquids until 3 hours before surgery. And then there's some numbers to call if I have any questions. Okay, that's that. So what to expect after surgery. The anesthesia team takes an active role in your post-operative care to provide relief of surgical discomfort and to assess your return to normal functioning. Immediately after your surgery, you will be brought into the I'm not sure what that acronym is for, but it's a waiting area. An oxygen mask may be placed on your face, delivering 100% oxygen until you are fully awake and breathing well while in the PACU, don't know. You will not be able to drink or eat and are not allowed to have visitors. I don't know how true that is, because there was definitely people in there with me last time. During your stay in that waiting area, the nursing staff will monitor your vital signs closely, ensuring that you are able to cough, swallow, and are sufficiently awake and responding appropriately. The type of surgery and anesthesia you receive will determine your length of stay and overall post-operative course. Literally, it's saying that like you'll hang out there and they'll make sure that you're okay, and then until they have decided that you are in fact okay to leave, of course, under the supervision of whoever it is that's driving you. Basically, yeah, you have to stay until they say that you can go. That's it. Okay, the do's and don'ts after anesthesia. Do's: do leave the healthcare facility accompanied by a responsible adult. Do remain quietly at home for the day and rest, obviously. Do arrange for someone to care for your small children for the day. I don't have any, but I do have dogs, and my dad will help with them. Take liquids first and slowly progress to a light meal. Don'ts: don't drive a car for at least 24 hours. Don't operate complex equipment for at least 24 hours. Don't make any important decisions or sign any legal documents for the day. Don't take any medications unless prescribed or discussed with your prescribed by or discussed with your physician. And then don't drink alcohol for at least 24 hours. Don't try and get up the first time without someone from the APU staff. Okay, that's all of that. And then there's home care instructions. Swelling and mild bruising of the reconstructed breast is normal. This gradually subsides. This is all stuff we know. A soft bra or camisole is provided for comfort and support. This should be worn 24 hours a day as tolerated until your first follow-up appointment. If it is too tight or too loose, you may adjust it, and it can be removed for showering. But yeah, my point is that there is instructions for literally everything. They will leave nothing in question. You'll know everything they want or need you to know. I've already gone over the medications, told you about the nail situation. Okay, so beyond all of that and the fact that I am on my, I love that you can see his nose right now, that I'm just not feeling so hot right now. I also have fibromyalgia, which I don't know that I've actually mentioned on my channel at all. It's not something that I, want to announce to the world every second, especially because even though I've had this diagnosis for a couple years now, it's still like, it's just a weird thing because it's not something that's like super well understood, and people have super varying symptoms, and they're different from day to day, let alone like when your stress levels are higher, or even when there's like big changes in like atmospheric pressure and all kinds of stuff. So on top of me, like I said a bajillion times, having a shitty period going on right now, I'm just feeling extra terrible. And then period emotions combined with the stress of everything that's going on and whatever, I'm like literally on the verge of tears right now. Be back. Oh, well, that was actually funny timing. Okay, so that was a couple guys that come by and walk the dogs, because I can walk one of them at a time, but if I try to walk both of them, I don't want to cry right now, but I am super on the verge of tears. Just like my hands and my shoulders and stuff will start to hurt really fast, and especially if they see something like an animal run by, like squirrel or whatever it is, that they'll try to chase it, and I just can't. It hurts too bad for me to like whatever. Anyways, I know all of the recordings from today are super spacey, but I'm just kind of having a day, but we all go through it sometimes, right? Okay, so until I have anything more to say, I think that's all for now. Okay, bye. Hi. Okay, so last time I was checking in with you was a couple days ago. It is now Monday, and that was Friday, and I'm doing much better, but I'm probably gonna leave that clip in because it's just the reality of the situation. I would also like to note that I am currently wearing the bra that I've done all my comparisons in, and it fits with a little bit of spillage right here, which I have been on my period for like a week, so hopefully that's ending now. But I know they do swell a little bit during that time of the month or whatever, whenever it decides to show up. But yeah, so I mean, my boobs are smaller than they used to be, but they're still definitely filling out this bra. So whatever that, oh, it's a 32 or 34 triple D. Anyways, I have everything gathered once again for my reduction, and I'm just going to very quickly go over all of that. First of all, last time when I went to my surgery, I had a zip up like fleece, but obviously it was winter then, it's summer now, and even this is probably going to be a little bit too warm, but it's the only really like button up type of shirt that I have. Like I don't have a short sleeve button up, so like this is what I'm planning on wearing to surgery with just leggings. You are supposed to wear something that's easy to take off and put back on. So there's that. I already showed you this, so this is the bra that I will be taking with me. I do also have a bag right here to put all the things that I need with me on surgery day or around surgery day, so that I don't misplace anything, forget about anything, all together. The medications I've already mentioned. I'm just about to put the morning of tablet with the bag I was just talking about. So that goes in there, and then I have my medications for afterward, but I don't need to take those with me, so I am gonna set them aside before I forget about it. There's more in the box, but just a few things. Like I have puzzle books, a couple books I've been meaning to read or want to look at more, but easy access. I just have them sitting, well, I brought them in here to record this, but they're by my bed. These things are so noisy. The wipes, all the instructions, which I believe I mentioned or went over all of them with you in the prior clip you just watched. For pajamas afterwards, these are pajamas I already had, but I have them handy because most of the things that I wear to sleep in are just like t-shirts and boxers, but these two sets happen to be from Victoria's Secret, but they're just the only two like tops that are button-ups. So that's what I'm planning to wear afterward, and they're silky, so they're more comfortable when it's warm. suppose that's a good thing. And then this, which you saw in my last breast reduction video, I wore the shenanigans out of this robe, and I wear it all the time still. It's so comfy, and it's short, so it's just not too much. It zips up. I told you the brand before, but it's Cervantes. There's that. Very comfy. Highly recommend. I will show you on screen a couple things that I'm not going to bother lugging in here. So same things that I used before for my first reduction. That pillow system, or like foam, I don't know what to call it, but it's meant for bed rest, and it worked for me. It worked very well for me the first time around, and I even use it, or have been using it a lot, not to do with the reduction, but I'm definitely going to be using that again this time, as well as the bed table, the bed table that I got that has the it has a top that kind of can be propped up with a little ledge where you can set either like a book, or I have my iPad charging so that I can watch like shows on it or whatever. And then in this lovely little wicker box, I have a magazine. I got a couple coloring books, because last time I realized that I had all the things that I needed to be able to take care of myself, but I was just getting like a lot of cabin fever and really bored. And so this time I tried to make sure that I have more just different things to keep myself and my mind entertained while I'm stuck sitting there, because as we all know from my previous videos, if you've watched them, I felt pretty good pretty fast after my reduction, and I'm hoping that that's the case again. But what I learned is that even if you're feeling well and you feel like you can move, however, it's just not good for you. And the best thing that you can do for yourself to like heal the fastest is to minimize your movement, even if it feels okay to move more. So this time I'm going to really try to honor those instructions of like limiting your arm mobility, even if it feels okay, to ensure that healing process happens as smoothly as possible. I don't know if I was talking to a friend when I said this or the camera, but I realized that it's kind of similar to when you're on a long flight and you just get bored sitting there, that I'm trying to kind of treat it the same way, where like I can't really move around, I can't do a lot, so I'm gonna try to make sure I have entertainment at my fingertips. And then, for my nails, the last time you saw me, they were, I had just started taking off the SNS. I was like grinding it down, soaking it off. And I did finish doing that. Right now, these are actually just like press-on, glue-on nails, because I hate having my bare nails. I just get so like, I just don't like it. So I have these ones on right now. I think they're very pretty. And I have multiple other sets in here so that as I get bored, I don't necessarily have to go get them done, but I can feel satisfied from home. I restocked my fridge with soup, juice, Pedialyte, milk of magnesia. I learned last time around that the mint flavor is disgusting, in my opinion, and I think it's the wild cherry flavor is pretty decent considering it's a medicine. So I got that again. Those are all my recommendations for preparing. The other couple things to note, it's now 7:50 p.m. Had a long day of like errands and studying. I have 3 exams tomorrow because I'm taking one ahead of time because my surgery is the day the test should have been. My dad arrives in less than 2 hours. So once I wrap this up, I'm gonna study just a little bit more. I'm gonna go pick him up from the airport, and then we'll go through the next day. And my friend Kyle will actually be coming along to like surgery day so that he can record when my dad's busy, focused, on driving and like actually getting me in and out of the car and stuff. I asked Kyle if he would come so that he can record some of those things that I didn't record the last time around and wouldn't have been able to record this time around. So I might actually publish this video beforehand, otherwise it's just going to end up being too long. But this should have shown you all of the preparations and the kind of days leading up and how that's been, and captured some of my feelings about it too. I want to talk about one more thing before I close out, I guess, this video, or maybe I'll close it out with getting to see my dad. I haven't seen my dad in too long, almost 2 years. I've gotten a few comments on, mostly on Instagram, and all from ignorant men, about the fact that I got a reduction and then I'm getting a second reduction. And it's like, come on, man, can you not see that, like, my boobs are still big on my frame? Like, they're bigger than I need. I'm not proportionate. No matter, it's my decision, it's my body, and for those of you watching who are mostly females who are going through the same experience, I know you understand, but I just want to voice that, like, all these people who want to insert their opinions where they do not belong about your body and what you want and what's best for you can go kick rocks. Like, make the decision that's right for you, honor your body, honor what's best for you, and you're the only person that knows that. So I just want to say that, like, if you've gotten flack or you are dealing with either friends, family, or otherwise who don't understand, who don't get it, they're not living in your body and they don't know what it feels like to lug these things around. And, like, honestly, just, like, in one ear, out the other, let it go, you know? Anyways, those are all the actual things that I have in preparation for this surgery. If anything else comes to mind that I have forgotten, which I don't think is the case, I'll mention it. And until next time, bye! Oh my god, I'm back again. I was not planning on this, but I'm trying to actually capture how things are. So I'm going to get my dad right now from the airport, and I have crazy butterflies, and I was like, why do I feel nervous? I'm just going to get my dad. And I realized it's not because I'm going to get my dad. I am excited to see him and that he's, like, going to be here and stuff, but it's like the final thing is setting in that, like, because I'm picking him up, that means that it's time. Like, I have those exams tomorrow, and then it's, like, time for surgery, and him arriving is, like, the signifier of that. And so, like, for real, the butterflies are, like, fully hitting now, and it's not bad butterflies. It's like, what are those called? Not endorphins, adrenaline. I get adrenaline when I'm like even about to take a test or something like that. I just get, like, really amped up, and that is how I feel right now. Okay, bye. I see him, but he doesn't see me. Dad! Do you want him to just put it in the back seat? It's Jeff's car.
Okay. Hi, honey. I just calling you. So are you in the cruise? Or car on your lap?
No.
Oh my God.
I'm in, this is Jeff's car.
Okay.
Okay. I was recording. It's recording.
Oh, hi.
Okay, bye.